Hi, this is Dr. Chaya Biswas, and I was getting a little bored, so thought of making some educational videos. Today's topic for the educational video is ankylosing spondylitis. So, what is ankylosing spondylitis, or AS as we call it? Ankylosing spondylitis is a type of spondyloarthritis. It is a rheumatic disease. So what is a rheumatic disease? Rheumatic diseases are autoimmune inflammatory diseases where your own body attacks its own cells. And what is spondyloarthritis? I just said it is a type of spondyloarthritis. So what is spondyloarthritis? It has two words. Okay, so spondylitis and arthritis. Spondylitis is inflammation of the spine. Arthritis is inflammation of the joints. And it is characterized by chronic inflammation of the axial skeleton. So axial skeleton is all the bones and joints that are confined to the midline of the body, and appendicular skeleton, all the peripheral joints and bones. Okay, if we come to the epidemiology part, males are at greater risk, like they are at 2 to 3 times more at risk than females. If a person is HLA-B27 seropositive, they have a very strong connection, like they will have a very strong connection with ankylosing spondylitis. If we come to the clinical features part, they will have, like patients will have inflammatory back pain. Okay, how will you know whether your back pain is inflammatory? If you experience 4 of the 5 features, okay, like what I'm going to tell right now, if you experience 4 of the 5 features, then it's a greater, chance that it's inflammatory only. Okay, so first is if your age is less than 40. Second is if your back pain is more than 3 months. Third is it is insidious in onset. Fourth is your back pain goes away with exercise and it returns back with inactivity. And the fifth is it is associated with morning stiffness. Okay, so if you experience 4 of these 5 features, then it is inflammatory back pain. So you will experience inflammatory back pain, and neck stiffness, and neck pain and stiffness, like stiffness of the joints in general. It usually comes with advanced disease. Okay, advanced disease. And we have done with the epidemiology part, we have done with the clinical features part. Ankylosing spondylitis also have some extra-articular manifestations. Extra-articular manifestations include anterior uveitis, which is the most common. It is characterized by lacrimation, photophobia, unilateral eye pain. Okay, and there's also another extra-articular manifestation. It is inflammatory bowel disease. Okay, so now how will you confirm like whether this is ankylosing spondylitis or not? See, there is no specific laboratory investigations at present, but if you do pelvic radiographs, you will find there is sacroiliitis. So what sacroiliitis? Sacroiliitis is the hallmark of ankylosing spondylitis. Okay, which is characterized by there will be bone erosion, sclerosis at the level of the sacroiliac joint. Over time, these erosions and sclerosis, they will give a classic bamboo spine appearance. Okay, and that's how you will know that the disease has progressed. Okay, if we come to the treatment part, there is no specific cure for ankylosing spondylitis at present. Only we treat the patient symptomatically. NSAIDs are the mainstay of medical therapy. Other non-pharmacologic therapies include visiting PMR, physical medicine and rehabilitation, educating the patient to avoid strenuous activities that may increase the risk of trauma or further fractures. So yeah, this was ankylosing spondylitis in a very short way, in a very gist way. If you watched the video till the end, then please give me a like. Okay. Yeah, thank you. Bye. Take care.